If you've ever been prescribed topical estrogen cream, you're probably missing this really important step on how to use it. I hear this all the time from my patients where they're prescribed this and they think that they're using it the correct way, just didn't get all the proper instructions. There just wasn't enough time. They're not getting the best benefit out of using the cream. So when we prescribe the cream, we usually prescribe a 0.5 gram to 1 gram. So if we're talking in terms of chocolate, which is my love language, one of them, it's about a peanut M&M to a chocolate M&M. You put it to the finger pad, or you can put it on the applicator depending on what your preference is. It goes into the vagina and you want to rub it in kind of like a lotion, because where it lands is where it lands. It's not going to really penetrate the tissue unless you rub it in. So similar to when you're putting lotion on your legs and you want to rub it in and not just put a blob right on your knee, it doesn't get spread around. Same thing with the vaginal estrogen cream. Do your best to try to rub it in. And then as you're coming out of the vagina, whatever's left over on your finger or the applicator, this is an important step that's often overmissed. You want to put at the opening of the vagina. This is really, really important, because if you just put it in the vagina and you stop, that's it, then you're not getting it to the vaginal opening, which is where you have a lot of dryness symptoms and pain with relations and things like that. Also remember, vagina and the urethra originate from the urogenital sinus, which is why they share the same estrogen receptors. And if you put the estrogen cream vaginally, you're actually benefiting the urethra and the bladder because they're so anatomically close. The urethra lives in the ceiling of the vagina. So we put the cream in the vagina and it gets where it needs to go in the urethra and the bladder without having to put it actually in the urethra and the bladder. So again, be sure that you put it into the vagina, rub it in, put it to the opening. Don't miss that step, and you'll be feeling so much better.